Radiation. The very word evokes a sense of mystery, perhaps even fear. It's a powerful force, invisible to the naked eye, yet capable of both harm and healing. In the realm of healthcare, radiation occupies a fascinating duality. It's a tool with immense potential for good, yet one that demands our utmost respect and caution. We encounter radiation in our daily lives from natural sources like the sun, and even from some building materials. However, when harnessed for medical purposes, radiation can be used to diagnose and treat a wide range of conditions, from bone fractures to cancer. But this incredible power comes at a price. Exposure to high levels of radiation can have detrimental effects on our health, increasing the risk of various diseases, including cancer. This begs the question, is medical radiation a miracle cure or a potential menace? The answer, as with many things in medicine, is not so simple. It's about carefully weighing the benefits against the risks, understanding the nuances of radiation, and employing it judiciously to maximize its healing potential while minimizing its potential harm. To comprehend the implications of medical radiation, we must first grasp its fundamental nature. Simply put, radiation is energy that travels in the form of waves or particles. This energy originates from the atom, the basic building block of all matter. When atoms have excess energy, they release this energy in the form of radiation. This process, known as radioactive decay, can occur naturally or be induced artificially. There are different types of radiation, each with its own characteristics and effects on living tissue. Two common types used in medicine are X-rays and gamma rays. X-rays, a form of electromagnetic radiation, are produced by machines and are commonly used for imaging purposes. Gamma rays, on the other hand, are a higher energy form of electromagnetic radiation emitted by radioactive materials and are often used in cancer treatment. Understanding the different types of radiation and their properties is crucial in harnessing their power safely and effectively for medical applications. It's this knowledge that allows healthcare professionals to select the most appropriate type and dose of radiation for each patient and procedure, maximizing benefits while minimizing risks. One of the most revolutionary applications of radiation in healthcare lies in its ability to provide us with a window into the human body. Diagnostic imaging techniques, many of which utilize radiation, have transformed the way doctors diagnose and monitor a wide range of medical conditions. X-rays, the most well-known form of medical radiation, are commonly used to visualize bones and detect fractures. During an X-ray, a beam of X-rays is passed through the body, and the image is captured on a special film or detector. Dense structures like bones absorb more X-rays, appearing white on the image, while softer tissues allow more X-rays to pass through, appearing darker. Computed tomography, CT scans, another widely used diagnostic tool, utilize X-rays to create detailed cross-sectional images of the body. CT scans provide valuable information about the size, shape, and location of organs, tissues, and abnormalities, aiding in the diagnosis of a wide range of conditions, from tumors to internal injuries. Other imaging techniques such as positron emission tomography, PET, scans, use radioactive substances called tracers to visualize specific bodily functions and diagnose diseases in their early stages. PET scans are particularly useful in detecting cancer and monitoring its response to treatment. Beyond its diagnostic prowess, radiation has emerged as a powerful tool in the fight against diseases like cancer. Radiation therapy, also known as radiotherapy, uses high-energy radiation beams to destroy cancer cells or impede their growth. This targeted approach to treatment aims to deliver a lethal dose of radiation to the tumor while sparing surrounding healthy tissues. Depending on the type, location, and stage of cancer, radiation therapy can be administered externally using a machine called a linear accelerator, or internally using radioactive implants placed near the tumor. External beam radiation therapy is the most common type of radiation therapy, where the radiation beams are generated by a machine outside the body and precisely directed at the tumor. Intensity modulated radiation therapy, IMRT, a more advanced form of external beam radiation therapy, allows for even greater precision in targeting the tumor, minimizing damage to surrounding healthy tissues. Internal radiation therapy, also known as brachytherapy, involves placing radioactive sources directly into or near the tumor. This allows for a higher dose of radiation to be delivered to the tumor while minimizing exposure to surrounding healthy tissues. Brachytherapy is often used to treat prostate, cervical, and breast cancers. Section 5. Beyond diagnosis and treatment, radiation's role in sterilization. While often associated with diagnosis and treatment, radiation's applications in healthcare extend beyond these domains. One often overlooked yet crucial application of radiation lies in sterilization. Radiation sterilization plays a vital role in ensuring the safety and sterility of medical devices and equipment, protecting patients from potentially life-threatening infections. The high-energy radiation used in sterilization processes effectively destroys bacteria, viruses, and other microorganisms on medical devices, rendering them safe for use. This method of sterilization is particularly well-suited for heat-sensitive materials that cannot withstand traditional heat sterilization techniques. From surgical instruments and syringes to bandages and implants, a wide range of medical supplies undergo radiation sterilization before they reach healthcare facilities. This ensures that the tools used in medical procedures are free from harmful microorganisms, minimizing the risk of infection and promoting patient safety. Radiation sterilization also plays a crucial role in the food industry, extending the shelf life of certain foods and preventing foodborne illnesses. By eliminating harmful bacteria and other microorganisms, radiation sterilization helps to ensure the safety and quality of our food supply. Section 6. Weighing the risks, the potential harms of radiation exposure. While the benefits of medical radiation in diagnosis, treatment, and sterilization are undeniable, it's crucial to acknowledge and understand the potential risks associated with radiation exposure. Radiation in high doses can damage living tissues and cells, leading to a range of health problems. The severity of these effects depends on several factors, including the type and amount of radiation exposure, the duration of exposure, and the individual's age and overall health. Short-term effects of high-dose radiation exposure can include skin burns, nausea, vomiting, and hair loss. Long-term effects, which may take years or even decades to manifest, can include an increased risk of cancer and other diseases. It's important to note that the doses of radiation used in diagnostic imaging are generally very low and considered safe for most individuals. However, repeated exposure to even low doses of radiation over time can have cumulative effects, so it's essential to minimize unnecessary exposures. Radiation therapy, while highly effective in treating cancer, can also have side effects, both short-term and long-term. These side effects vary depending on the type of cancer being treated, the location of the tumor, and the dose of radiation used. Common side effects of radiation therapy can include fatigue, skin irritation, and hair loss in the treated area. Section 7. Shielding ourselves, minimizing radiation exposure in healthcare. Given the potential risks associated with radiation exposure, it's imperative to take appropriate safety measures to minimize unnecessary exposures, particularly in healthcare settings where radiation is frequently used. Healthcare professionals are trained in radiation safety protocols and follow strict guidelines to minimize exposure for both patients and themselves. One of the fundamental principles of radiation safety is minimizing the time of exposure. The shorter the exposure time, the lower the radiation dose. Another principle is maximizing the distance from the radiation source. Radiation intensity decreases rapidly with distance, so maintaining a safe distance from the source is crucial. Shielding is another important aspect of radiation safety. Lead aprons, thyroid shields, and other protective gear are often used to shield patients and healthcare workers from unnecessary radiation exposure during medical procedures. These shields are made of materials that effectively absorb or block radiation, reducing the amount of radiation that reaches the body. Regular monitoring of radiation exposure is also essential for healthcare professionals who work with radiation sources. Personal dosimeters are worn by these individuals to track their cumulative radiation exposure over time, ensuring that it remains within safe limits. Section 8. Striking a balance, maximizing benefits, minimizing risks. Radiation, like many powerful tools in medicine, presents us with a delicate balance. The potential for immense good, accompanied by inherent risks. The key to harnessing the power of radiation for healing, while safeguarding our health, lies in understanding both sides of this equation. By acknowledging the potential benefits and risks of medical radiation, we can make informed decisions about its use. Patients should feel empowered to discuss their concerns and ask questions about radiation exposure with their healthcare providers. Open communication between patients and healthcare professionals is essential in ensuring that radiation is used judiciously and appropriately. As technology advances, we continue to develop new and innovative ways to utilize radiation in medicine, pushing the boundaries of diagnosis and treatment. With each advancement comes the responsibility to carefully weigh the potential benefits against the potential risks, always striving to maximize the healing potential of radiation while minimizing its potential harm. The future of radiation in healthcare is promising, but it's a future that must be navigated with caution and respect for the power we wield. By embracing a balanced approach, one that acknowledges both the miracles and the menaces of radiation, we can harness this powerful tool to improve human health while safeguarding our well-being for generations to come.